Hi everyone, happy Tuesday. Thank you for tuning in and welcome to episode 6 of Kannakids. Today I will be talking about when and why THC may be used in a child's medical regimen in conjunction with cannabinoids such as CBD. Oh, the gasps, I can hear them now. I did indeed just go there. THC used medically for children. Some children and their conditions may require just a little more umph to provide relief, and this sometimes comes in the form of an additional low dose of THC that is added to a profile of cannabinoids and terpenes. Please keep an open mind here and know that we are talking about micro doses of THC that are safe and not a detriment to the child, and ultimately can provide some children with greater relief and much improved quality of life. This is not a first line, but rather it's something that may be and can be considered on a case-by-case basis. Please keep in mind that this will only be a recommendation from a certified medical healthcare professional who is proficient in medical cannabis and feels that your child will benefit from a slight increase in dosing of THC, and it is not something that will be required if you as the parent do not agree with adding this to your child's medical regimen. The ultimate goal here is to provide relief to your child, and to achieve this in collaboration between the parent and healthcare professional in a way that is best suited for your child. The healthcare professional can only provide recommendations they see fit for your child, and the rest is up to you, the parent, to decide whether or not this is the right avenue. Now, for those who may be tuning in for the first time, I'm Vanessa, the medical cannabis nurse for kids, as well as the owner and CEO of Elevated Healing. Kannakids is my vlogging educational series that is released every Tuesday, covering a new topic about medical cannabis. The purpose of this series is to provide you with the most up-to-date information you need to determine if medical cannabis is truly the right option for your child and their condition. Please note that I still advise, as many others would, that you should work hand in hand with a healthcare professional who is proficient in medical cannabis and your child's condition. Before I jump into this topic of THC use for pediatric conditions, I do want to address that there are a number of studies out there that show that THC can have detrimental effects on a child's developing brain. This is indeed true. But I want to note here that these studies are focusing on teenagers using recreational cannabis strains that contain high levels of THC. When potent strains of cannabis are introduced to a developing body and brain, yes, this can lead to cognitive deficits and other developmental issues. But when THC is added to a child's regimen by a healthcare professional, it's done from a medical perspective using a high-quality product that is not recreational, and with the goal of achieving symptom relief with the lowest dose possible, and it's in conjunction with a cannabinoid profile such as CBD. Also, if you've been following my series at all, you recall that a full Spectrum Hemp product already contains THC. And you may be asking, well then why more THC? Why would it be added to my child's medical regimen? Full Spectrum Hemp does indeed contain some THC, but it's less than 0.3%. And that amount of THC can vary from product to product. This is why it's important to check out a company's lab report, which is also known as certificate of analysis, to confirm exactly how much THC is in that particular product. While full spectrum hemp contains small concentrations of THC, these small concentrations are sometimes just not enough for some pediatric conditions. Pediatric conditions that have had much greater success with just a small increase in THC dosing include severe behavioral conditions associated with autism spectrum disorders such as violent meltdowns, self-injurious behaviors, obsessive compulsive behavior, and combativeness. Other conditions that also benefit with a slight increase in THC dosing include treatment-resistant epilepsy, neuroblastoma, which is a rare cancer but common in pediatrics, Tourette's, and ADHD. Now, you're probably thinking and concerned that your child will get high with an increased dose of THC, but remember that your child will also be ingesting CBD with their regimen, which is the antidote or buffer, if you will, for THC. So this means that CBD counteracts the high effect of THC while still providing all of the benefits of THC, which include anti-inflammation, neuroprotection, anti-tumor properties, as well as regulates and normalizes the immune system. These properties of THC are what help provide relief for many of these children because many of these conditions require a reduction in inflammation, improved neurological qualities, as well as the regulation of the immune system that is often contributing to the problem. When the dose of THC is slightly increased, the dose of CBD will also be increased as well to ensure the prevention of the high that is produced by THC while providing all of the benefit and ultimately symptom relief. So what cases could potentially benefit from a slight increase in THC? Please note, this is affected by a patient-by-patient basis, and not all children with the same condition or conditions will require an increase in dose of THC. Every child's body and endocannabinoid system will metabolize and respond to medical cannabis differently. This is why finding the right dose and cannabis profile for a patient and their particular condition requires trial and error and therefore remains an art. Please always work with a healthcare professional proficient in medical cannabis. So some studies have found greater symptom relief with certain pediatric conditions with a slight increase in THC dosing, such as treatment-resistant epilepsy, behavioral conditions related to autism spectrum disorder, cancers such as neuroblastoma, which is a common pediatric cancer, and Tourette's. Research surrounding the use of CBD and a combination of CBD and THC-rich products for treatment-resistant epilepsy is where it all began. Several studies have found that higher doses of CBD with small increased doses of THC resulted in a significant decrease in the number of seizure episodes, while also improving overall mood, increasing alertness, better sleep, and an increased ability to perform activities of daily living, such as dressing oneself independently, brushing teeth, washing, amongst other things. When researchers found secondary benefits of the higher doses of CBD and THC for treatment-resistant epilepsy, more research was done and found to be beneficial for other conditions, such as those behavioral conditions associated with autism spectrum disorder. For instance, a large study done in Israel on children with autism spectrum disorder suffering from violent meltdowns, high anxiety, and self-injurious behaviors found that 80% of the participants experienced significant improvement in hyperactivity, 82% saw improvement in self-injurious behavior, while 60% saw an improvement in sleep. Furthermore, studies conducted on the use of THC and CBD for neuroblastoma found a significant decrease in the growth of the tumor. Neuroblastoma is a very rare form of cancer, but most commonly occurs in children and most commonly affects the adrenal glands, which sit on top of the kidneys. So the point of today's topic is that some pediatric conditions do respond better and have greater symptom relief when the dose of THC is just slightly increased. However, not every child with the same condition will require an increase in the dose of THC. The first step would be to start with a full spectrum hemp product that contains a small amount of THC and see how your child responds over time. Again, it is strongly encouraged and advised to work with a healthcare professional proficient in medical cannabis that can recommend a full spectrum hemp product that is trustworthy, safe, and contains the right cannabinoid, THC, and terpene profile that may be the most effective for your child and their condition. Lastly, not all children and their families will have the advantage of having access to products that contain higher levels of THC that may work for their child and their condition. This will be state dependent in terms of legalization and also if your child qualifies to obtain a medical marijuana card in your state that can only be granted by a qualified physician. This is not only for access but also for protection. Again, speaking and working closely with a medical professional who is proficient in this area can guide you through this process, and it's highly advised. Well, that is it for today. I hope you learned something about today's topic. If you or anyone you know is seeking to add medical cannabis to their regimen, but they have a lot of questions as to how to do so, speaking with a healthcare professional proficient in medical cannabis is strongly encouraged and advised. Here at Elevated Healing, we provide you with the guidance you need in navigating the world of cannabis for your child and their condition. So please visit www.elevated-healing.com. Also, please share this video with anyone you think may enjoy it, and please subscribe to my YouTube channel, Kannakids. Enjoy the rest of your week, and Happy New Year to everyone. Until I see you next week, be safe, be healthy, and always know there's hope around the corner. Bye, everyone.